Now, did you know Ireland ranks the second highest in Europe for smartphone usage? Now, with overexposure to computer screens proven to worsen dry eye symptoms, taking care of your eye is something that you should take priority. And joining me now is, with some expert advice on eye health, is consultant ophthalmologist Dr. Nikolina. Good morning to you, Doctor. How are you? We all are on our phones and our smartphones every day. We're like this so many hours of a day. So why does that affect our eyes?
So first of all, we have to ask ourselves when our eyes are healthy. Okay. So we usually have to have very good vision and disease-free eye. So if we use a computer and we feel quite comfortable, then probably everything is okay. But if we start to feel a little bit of redness or a strain of the eye, which is something that obviously using of a computer or exposure to the long time on the screen can cause. So those are the first symptoms of any kind of problems in the eye. So using the computer or using the mobile phone will first of all use the eye strain.
But like that's just, is that a tiredness where you feel tiredness in the eyes?
Tiredness, sometimes headache. Sometimes even the redness, then we start to rub our eyes. We feel like there's a sand in our eyes, a gritty sensation. So something obviously is wrong there. So, but we don't obviously pay attention, and then we just kind of ignore it.
And when reading the notes, I was fascinated that you say that our eye care should be as much as like the care we take for brushing our teeth or our skin, because they're so important to us, but we tend to ignore it. And I know I would always ignore that tiredness feeling, but until I wouldn't do anything with my eyes until I got a sty or a real sense of redness, and then I'd go and get drops or something like that. But before that, I'd never do anything, and I've ignored all the early signs.
Yes, and you'll probably seek help when you will have any symptoms. So that's mostly what patients do, ask any kind of advice or help from our care professionals, the ophthalmologist, what they need to do. So first of all, if you have the redness, if you have this gritty sensation, you should ask for the help. You should ask somebody to see your eye. So that's like what we call the regular eyesight test and regular eyesight checkup. So when we look at your eyes, then we can see, are there any problems on the ocular surface? And most of the time, we do see the dry eye patients. So in Ireland, I would say every 8th person has the dry eye.
Wow.
Which is like a big number. And it's also very big problem in the world. So what should we do? We should then take the eyesight test, and if we see that there is a problem with the eye, if it's a dry eye, then we can just think about what types of the dry eye are there. So we usually have 2 types of the dry eye. It can be evaporative, which means that it is connected with some kind of problems, either with small glands that are producing oil for our tears, because our tears have 3 layers. So if we don't have the stability of the tear film on the surface of our eye, then we can have the dry eye. And second, we can have either a problem with production of the tears, which can be connected to some kind of immune disorders with thyroid problems. So if the patient has also some kind of other medical problems, medical conditions, such as immune disorders, they should also seek for help.
Now, you have some drops here that will help with the dry eye.
Yes.
Now, I know when I ever have to use drops, I make a hames of it. I blink every time it should go in. I never get it really in properly. Can you demonstrate to us?
What should we do? First of all, we should try to find the perfect solution, the perfect drop for our eyes. Those are called lubricants. So lubricants are usually kind of the drops that are going to maintain the ocular health, but as well they are going to keep the tear film stability. So if you are seeking for lubricants that are going to work for you, you should first of all try to find the preservative-free. So that's very important. So preservative-free drops are very important because they won't aggravate the eye. They won't kind of cause any problems. Exactly. So when you use the lubricants, which, as I said, are preservative-free, what you should do, you should just pull your eyelid down. And then just squeeze one of the drop into the lower.
So you're not going right back. I'd be right back here.
Yeah, you don't have to lay down. You don't have to do
and every time the drop comes near you, I start blinking and it goes everywhere.
No, you don't have to do that. So basically, you can just sit like this, pull the lid down, and just squeeze one drop of the drop from the bottle inside of the lower eyelid. So one drop should be enough. If you have more drops, nothing will happen because the lubricant drops you can't overdo. So nothing will go wrong if you even use a bit more of the drops. Okay. There are different types of the drops. You can use the gel, you can use the drops, you can use the ointment, but always try to find the drops that are preservative-free and clinically proven, as, let's say, the Thealoz Duo drops.
Okay, now we had a lot of questions from our viewers because a lot of people, obviously, and we're saying, are eye drops suitable for children?
So if the children are fine and they don't have any symptoms, I wouldn't use the drops. But if parents are trying to find solution, if the eye is starting to rub the eye, if the child is having a bit red eye, if the child is working on the computer now, as we are, or during the lockdown of working from home and using our screens a bit more, obviously the eyes are getting more red, the tears are evaporating more, then we have a bit more of the strain. So yes, then the children can use them. Yes, the drops.
Does the brightness of the screen affect our eyes? Because sometimes I know on my phone, when I have my phone, I put it up to the brightest part. Is that wrong?
Yes, we should be mindful of that as well. So don't use the most brighter mode on your screen. Try to be moderate, because if you have the brighter screen, you will have a bit bigger strain of the eye, and as well you will have a bit more dry eye, the red eye.
So many more questions that our viewers, but we don't have time to get through. But great advice there. Thank you so much for coming in this morning. Now, coming up next, winter wardrobe staples on the catwalk. Stay tuned.